Hi, my name is Stephanie Apt, and today I'm reviewing Medicare Explained for 2021. We will go over all of the basics that you need to know and talk about the important choices you have to make when you're new to Medicare in 2021. So stay tuned.
Stay tuned!
Hi everyone, my name is Stephanie Apt. I am a licensed insurance broker and a Medicare specialist, and I help seniors all over the country to navigate the world of Medicare. And today's video is going to be Medicare Explained for 2021. So we're going to go over all that you need to know about Medicare, whether you're new to Medicare this year or maybe you just need a refresher course. That's what we'll talk about today. So we're going to be reviewing the different parts of Medicare. We're going to go over when to enroll, how to enroll in Medicare. We're also going to review all of the costs associated with Medicare. And we'll also be reviewing Medicare supplement plans or Medigap plans, as well as Medicare Advantage plans, and going over the decisions you're going to have to make when you transition to Medicare. So let's start by just reviewing the basics, the different parts of Medicare that you need to know. So there's Medicare Part A, which is your hospital insurance. There's Medicare Part B, your medical insurance. And then there's Part C of Medicare. That's also known as Medicare Advantage. This is an optional part of Medicare that you can elect, and we'll talk more about that in a minute. And then Medicare Part D is your prescription drug coverage component of Medicare. So your Medicare enrollment period is a 7-month window. And this starts up to 3 months before the month you turn 65, and it goes up to 3 months after your 65th birth month. And that's also called your IEP, your initial enrollment period for Medicare. That's when you can sign up. As long as you sign up before your 65th birth month, your Medicare coverage will start on the first day of the month that you turn 65. Unless you're born on the first of the month. That's a little tricky thing. If you're born on the first of the month, your Medicare coverage will actually begin a month prior. If you enroll in the latter part of this initial enrollment window, then your Medicare coverage could be delayed by a few months. And I'm going to link some more information below about when your coverage will start, depending on when you enroll. If you're collecting Social Security benefits, and you've been collecting Social Security benefits at least 4 months before you turn 65, you don't have to do anything to enroll in Medicare. The government automatically enrolls you in Medicare Parts A and B, and they'll send you your Medicare card in the mail a couple months before you turn 65. But if you're not collecting Social Security benefits, then you do actively have to enroll in Medicare. And there's a few different ways that you can do this during your initial enrollment period. You can enroll online. It's a pretty simple way. I'm going to link a video up here that talks a little bit more about how exactly to enroll in Medicare online. You can also call Social Security, or you can go down to your Social Security office in person. Of course, some Social Security offices are not scheduling very many appointments due to the COVID pandemic. So most people these days are either applying online or calling Social Security to get enrolled in Medicare. And when you go to sign up for Medicare, you'll be enrolling in Medicare Parts A and B. Medicare Parts A and B are what we call original Medicare, or they may be known as traditional Medicare. So Part A is your hospital insurance, and that is usually free as long as you've been working in the United States for 10 years or 40 quarters. And this part of Medicare helps to cover your inpatient hospital stays. It'll also help to cover things like skilled nursing facility care, some types of home health care and hospice as well. Medicare Part B is your medical insurance. And so this is the part of Medicare that will cover outpatient medical services, doctor's office visits, testing, ambulance, a whole slew of things are covered by Medicare Part B. And Medicare Part B isn't free. A lot of people are surprised to find out that they do have to pay to enroll in Medicare Part B. In 2021, the standard Medicare Part B premium is $148.50 per month. However, it may be more based on your income. So there's something called IRMA, or an income-related monthly adjusted amount. And you may be subject to IRMA or higher premiums for Medicare Part B and Medicare Part D if your income from 2 years prior fell above one of these thresholds, whether you're married filing jointly or whether you file a joint tax return. And there are ways that you can appeal IRMA if your life situation has changed, but typically Medicare will look at your tax return from 2 years prior to determine whether you will be subject to IRMA. And they will usually let you know by sending you a letter in the mail if you're going to be subject to these higher charges. And you can check out a video I've linked all about how to appeal IRMA if you don't think that you should be paying these higher charges if you've had a life-changing event. So when you sign up for Medicare Parts A and B, what exactly does it cover and what are your out-of-pocket responsibilities? So that's what we'll talk a little bit about here. Medicare Part A has an inpatient hospital deductible, and this deductible in 2021 is $1,484. So that's the amount that you have to pay before your Medicare Part A benefits kick in. And this deductible is not an annual deductible, it is per 60-day benefit period. So if you have multiple hospital stays within a calendar year, you may need to meet this deductible more than once. If you have a long-term stay in the hospital, after you've been in the hospital for 60 days, you will be responsible for a co-insurance amount of $371 per day. Additionally, if you're in the hospital past 90 days, your co-insurance is going to go up to $742 per day. And if you are in a skilled nursing facility, Medicare covers your first 20 days in the skilled nursing facility, and then after that, you're responsible for $185.50 per day for days 21 to 100. Now on the Medicare Part B side of things, which is again going to be everything doctor's office, outpatient, all the other medical services that Medicare covers, Medicare Part B also has a deductible, an annual deductible that resets every January. And this is the amount that you have to pay before Medicare Part B starts to kick in. The deductible this year is $203. So that's what you're responsible for before Medicare is going to kick in. After you've met your Part B deductible, Medicare is going to pay 80% and you have to pay the rest, the other 20%. And this is where you're left really vulnerable, right? Because there's no cap on that 20%. So if you have something major happen to your health, you are responsible for that full 20%, and there is no cap or limit there. So under traditional Medicare Parts A and B, you do have potentially large out-of-pocket exposure. So that's why a lot of people look at some type of gap coverage, like a Medicare supplement Medigap plan, or perhaps a Medicare Advantage plan to help cap these out-of-pocket costs that you would be responsible for under traditional Medicare. So that's what I'm going to talk about next. So I've been using this flowchart for a while, and I'm going to use it again in this video. I think it can help you to visually understand what your options are and what your choices are when you enroll in Medicare. So you can kind of start at the top, start here and decide how do you want to get your Medicare benefits. So the first choice that you have is original Medicare or traditional Medicare. And that's what we just reviewed, Parts A and B. One of the benefits of going this route, going with traditional Medicare, is that you can go to any doctor that takes Medicare. So you have your choice of doctors nationwide. All over the US, there are many, many doctors that accept Medicare patients. So if you go this route, you really do have your pick of your doctors and your hospitals because you are staying with original Medicare. From here, you'll want to decide if you need drug coverage. And if you need coverage for your prescriptions, then you'll need to add on a standalone Medicare Part D prescription drug plan. And Medicare Part D drug plans are administered through private insurance companies. So you buy Part D through a private insurance company like Humana or SilverScript that offers Part D drug coverage. And Part D drug plans can vary quite a bit in cost. In 2021, in most states, plans are available starting at about $7 a month for a standalone Part D drug plan, and then the prices go up from there. And then the next step will be deciding if you want to add supplemental coverage. Now, if you're going this path of traditional Medicare, we've already reviewed all the potential out-of-pocket exposure that you have there. So most people decide to add on some type of supplemental coverage to cap their medical out-of-pocket exposure. And this is purchased through Medigap or Medicare supplement insurance. So your Medigap or your Medicare supplement plan is going to fill in all those gaps. It's going to pay all of those deductibles and co-insurance and all of those costs that we just talked about for you. And we're going to talk a little bit more about how Medigap and Medicare supplement plans work in just a moment here. So again, this is the one path that you do have. I would say the benefits of doing this path are that you have the freedom to choose your own doctors and hospitals. You don't need referrals. And if you do add on a Medicare supplement plan, you have very comprehensive coverage, very little out-of-pocket exposure because the Medigap plan is covering all of those deductibles and co-insurance for you, so you don't have to pay them. The other option that you have is to go with a Medicare Advantage plan, and this is also called Part C of Medicare that we mentioned briefly earlier in the video. Medicare Advantage plans are an alternative way to receive your Medicare benefits. So if you go with a Medicare Advantage plan, you still have to be enrolled in Medicare A and B. You still have to pay your Medicare Part B premium, so you still have to be enrolled in traditional Medicare. But if you sign up for a Medicare Advantage plan, then that managed care plan replaces your original Medicare benefits and acts as your insurance. So Medicare Advantage plans are managed care plans like HMOs or PPOs that you may have had in the past. And these types of plans typically include Medicare Part D prescription drug coverage rolled right into the plan. And Medicare Advantage plans have their own pros and cons. They're a good fit for some people, not the best fit for others. And we're going to talk a little bit more about that in just a second. So let's touch a little bit on Medigap plans. So the first column that we talked about, one of the steps was deciding if you need supplemental coverage. If you do, then you're going to be looking at Medigap, also known as Medicare Supplement Insurance, and that's going to fill in the gaps in your original Medicare A and B benefits. So Medigap plans are standardized. The government regulates how these plans are offered, and no matter what plan you choose, you can still continue to go to any Medicare doctor anywhere in the country. This chart is a lot to look at. It can be a little bit confusing. And in fact, there are some plans on here that are no longer available to people who are new to Medicare or turning 65 in 2021. But for example, I'm just going to talk a little bit about one of the most popular plans, which is Plan G right here, and explain to you how that plan works. So you can see that of all of the potential out-of-pocket costs right here, Plan G covers pretty much all of them. The only thing it doesn't cover is the Medicare Part B deductible. So that's all that you would be responsible for. And if you remember a moment ago, we reviewed that the Medicare Part B deductible this year is $203 per calendar year. So if you have original Medicare and a Plan G Medicare supplement, you're responsible for the first $203 of your medical expenses. But after that, everything else is covered at 100%. So you have very, very little out-of-pocket exposure if you go with a Medigap plan like Plan G. Again, these plans have no network, so you can go to any Medicare doctor you choose. And the way the plan works is your provider submits your claims to Medicare, and Medicare either approves or denies them, right? So as long as Medicare approves the claim, then your Medicare supplement plan must pay on the claim that Medicare has approved. So because of this, your care is really determined by you and your doctor. Medicare is going to approve most things that are medically necessary. So it's not up to an insurance company to decide whether or not your claim is going to be approved or denied. Any claim that Medicare approves, any Medigap or Medicare supplement plan must approve and pay on that claim as well. One other important thing to know about Medicare supplement plans that not everyone realizes is that in most states, Medigap plans are medically underwritten. And what that means is that the insurance company can ask you a series of health questions on your application, and based on your current health or your health history, they could decide to decline you and deny you coverage. However, everyone gets a one-time open enrollment window where they can choose any Medicare supplement plan they want with any company, and they're given the preferred rate without any medical underwriting. And that is either when you're first turning 65 or when you are first going on to Medicare Part B. So that's important to know, because outside of that window, you will have to typically pass through medical underwriting to get a Medicare supplement plan in most states. So now that we've talked about Medicare supplement plans and the pros and cons of how they work, let's look at the other side of the coin, which is the Medicare Advantage plans, and talk about the pros and cons there. And if you want a deeper dive into the pros and cons of Medicare Advantage, you can check out this video up here where we do a whole video all about Medicare Advantage pros, cons, and all that good stuff. So what are the pros of a Medicare Advantage plan? Well, one of the biggest is that they have very low monthly premiums. These plans are funded by the government. So the government pays these insurance companies when you enroll in their Medicare Advantage plan. And because of that, the insurance companies can pass on savings to you in the form of $0 premium or very low monthly premium costs. So that makes these plans very attractive to people because they have low monthly premiums, or in most areas, $0 a month premiums available. These plans also usually include your Part D prescription drug coverage built in, so you do not have to worry about buying a separate standalone Part D drug plan. Additionally, some Medicare Advantage plans include extra benefits that are not covered by original Medicare. So some things like dental, vision, or hearing services that traditional Medicare doesn't cover may be covered partially on certain Medicare Advantage plans. So a lot of people say, well, that sounds too good to be true. What's the catch? These plans, of course, do have a few downsides to them. One of them is that you're typically working in a more limited doctor network. So because these are managed care plans, like an HMO or a PPO, you have a set network of doctors that you really want to stay in, or else you may not have coverage at all, or you're going to pay a higher cost for your services. Additionally, the plans establish their own set of co-pays, co-insurance, and out-of-pocket costs that you are responsible for. So you may have certain co-pays for office visits, certain co-pays for hospital stay, and in 2021, the maximum out-of-pocket that you could be responsible for is up to $7,550 per year, and that is for in-network services, so it could be higher if you are out of network. And again, on a Medicare Advantage plan, your claims are being submitted not to Medicare, but to the insurance company that you have your Medicare Advantage plan through. Right, so you may see more need for things like prior authorization for certain services because the claims are submitted to the insurance carrier instead of to Medicare. So Medicare has a lot of ins and outs, a lot of rules, and there really are a lot of choices that you have to make when you are turning 65 or going on to Medicare for the first time. And we hear from our clients that it can be pretty overwhelming, especially when you factor in all of the maybe phone calls that you're getting or mail that you're getting. It can be difficult to navigate what you need to do. So I hope that this video helped give you a little bit more direction and information about the basics of Medicare for 2021. If you would like information, free, no obligation quotes, Medicare assistance, that is what we're here for. You can give us a call anytime. So I am an independent insurance broker and we're licensed in almost every state. So if you have any questions, please don't hesitate to give us a call. Our service is completely free of charge. So we get paid when we help you apply for your Medicare coverage. So that's how I make my living, and I would love the opportunity to assist you. I hope you found this information helpful. Check out some more of our videos, and thanks so much for watching. We'll see you soon.